Yeah, last night on the news at 6, we told you about a Maryland physician and midwife under investigation by state regulators. Meanwhile, WUSA 9 has learned of more allegations against her.
Yeah, several families say they want accountability after they paid the same midwife thousands of dollars to deliver their babies.
But instead of the beautiful home births they hoped for, they tell our Marcella Robertson they paid for care they never received.
Are you looking at me?
Why are you looking like that?
She robbed us of a lot.
You looking at me?
I really wanted this to bloom into like a beautiful friendship.
We planned and we paid for this experience to be wonderful, and it just sucks the air out of the room for us.
In 2023, these two Maryland families both hired Kai Parker as their midwife. Parker's home birth agreement repeatedly refers to her as Dr. Kai Parker, a naturopathic physician and midwife. The families say those credentials are why they hired her. They paid Parker's $7,500 fee. They didn't know it at the time, but according to state records, Parker's license to practice naturopathic medicine expired in 2022.
I wanted to go the holistic route.
When Makai Ashley made the decision to deliver her baby at home, she and her parents met with Parker. A trusted family doctor recommended her.
She was very kind. She was very warm. We liked her.
But in complaints filed with the Maryland Board of Nursing and the Maryland Board of Physicians, the Ashley family details how Parker missed appointments and was difficult to get a hold of.
And we moved forward with it, giving her the benefit of the doubt.
Labor and birth are listed as part of Parker's home birth package, but Makai says much of her labor was without her midwife.
Towards the end of my labor, I get fed up and I just can't do it anymore. I don't know where she is. I'm fully prepared to just do it on my own, and what happens, happens.
The first-time mother says Parker finally showed up minutes before she gave birth to her baby boy. But the family tells WUSA 9 the problems didn't stop there. Midwives in Maryland are required to report a baby's birth to the Division of Vital Records. They say that never happened, leaving Makai's now 5-month-old son with no birth certificate, no social security number, and no medical coverage.
The birth was never registered. No one outside of us telling them knows that this baby exists.
Yes, like, what is that?
Malachi and Shira Robinson were initially impressed with Parker.
When we got on the camera, she was like, you know what, I'm your midwife. And I was like, you know what, she sounded really, really nice.
But after that, the couple says they only saw their midwife in person for one prenatal appointment. The rest were virtual or didn't happen at all.
I thought it was going to be more hands-on. It went downhill the last few weeks, months of my pregnancy. Those really essential appointments kept getting rescheduled, kept basically chasing her to make those appointments to get her to see me.
Still, the Robinsons moved forward with Parker, hoping the birth would be different.
Creating plan B, C, D, because we had already invested, the entire amount that we paid out to her.
They also filed official complaints with state health regulators. In those complaints, Shira describes laboring without her midwife.
I started pushing.
Without your midwife here?
Mm-hmm. Yeah.
I called her like every 15, 20 minutes trying to get an update to see where she is. The app is saying it's time to go to the hospital. She said, well, I have to put my kids to sleep and I have to do this and I have to do that. So, I'll get to y'all when I can, and, I'm on my way.
The Robinsons say Parker made it in time to deliver their baby, but never showed up to the postpartum checkups promised in the home birth package.
Next day after that, I didn't hear anything. Then it started going. Day after that, I didn't hear anything.
It's like she just disappeared.
The couple says it was weeks before they heard from Parker again. During that time, they found Parker's midwifery license was still active in Maryland, but her license as a naturopathic doctor expired more than a year before they hired her.
Verbally, and of course her website, everything just mentioned that she is a licensed practitioner and a physician.
It was really a smack in the face. It really broke my heart.
When we dug further into Parker's background, we learned on January 10th, 2024, the Maryland Board of Physicians barred Parker from practicing naturopathic medicine in Maryland. 8 days later, the board charged Parker for practicing without a license and misrepresenting herself as a doctor. The board's disciplinary panel is set to hear the case in late April. But those charges stem from an investigation into Parker underway before the Robinsons and Ashleys ever went to state regulators for help. Both families still waiting to speak with both agencies about their complaints. WUSA 9 tried several times to reach Parker by phone and email to ask about these allegations. We have not heard back. Despite disciplinary action from one agency, we found Parker is still licensed in other jurisdictions, something these families say needs to change.
She should not be practicing medicine. She should not have the opportunity to have life and death in our hands.
We really just want accountability. We don't want her to see her practice. We don't want to see her do this to another family.
Parker is still licensed as a midwife in Virginia and as a naturopathic physician in D.C. The Board of Health in D.C. tells me there is an automatic review anytime there is disciplinary action in another jurisdiction, but it's unclear how long that review process takes. As of today, Parker's license in D.C. is still active. There are more allegations against Parker from other families. You can hear their stories on WUSA9.com. Marcella Robertson, WUSA 9.